Hey guys, it's Christine. Welcome back to my channel. So today I'm going to be making a video on how to ace your clinical evals. If I am looking to the side, it's because I've made a list of points that I want to hit and I don't want to forget them. So that's what I will be doing. But I first want to say that this is not a cookie cutter formula at all, because clinical evals involve people and people are complex, and I don't know what your institution's like. I don't know what your hospital is like. I don't know the relationship that your attendings and residents have with one another, as well as with med students. I could only speak from my experience, and what I can say about my institution is yeah, there are bad apples here and there, but that's everywhere. Overall, I've been really blessed to be in such a benign program. It's an amazing program. Really kind and caring faculties, residents who are so funny and relatable, real, and willing to teach. And so, I've had my fair share of horror stories, but I think that was related to their own stress and that particular specialty. And I don't think it was necessarily toward certain people maliciously. So that's how I like to think about it. Um, but yeah, I also want to say that there are multiple components to your clinical grades, and so this is going to be only touching upon the evals. Um, Depending on your institution, the breakdown of your grades might be different. Mine, usually it's like 50% clinical evals, and then the rest is comprised of NBMEs, which are the shelf exams, National Board Medical Examinations, and so it's kind of like final exam, and then OSCEs, which are standardized patient exams, and then depending on the rotation in your clerkship director, you might have like projects and assignments that you might need to accomplish. So that's kind of like the simplified version of the grade breakdown. And I'm going to approach this as if I am telling my own brother or my cousin's advice. Let's talk about some things I wish I had known before going into clinicals. Now, I don't have any doctors in my family, and I've only discovered Reddit this year, and so I was kind of clueless and I really didn't know what to expect. Sometimes I think that's a good thing, but yeah, let me just share some things with you. Number one, it will be busy. It's kind of like a relationship. It's gonna demand a lot of your time, your emotional capacity, as well as your dedication. But expect it to be a season of that. It's going to be challenging and it's going to push your limits, but that's a whole the growth part of becoming a physician. And if it was easy, everybody could do it. There's a reason that the medical training is so rigorous, and it's to produce people with resilience. And just remember that you're really privileged to be on top of that population. And so it is a unique season, and if you're in your young 20s and 30s, I just highly encourage to not be so active on social media. I got rid of my Instagram like months before my third year started, but yeah, I never really felt like I was missing out in life. Had I, been checking what other people were doing all the time, I think I might have been more miserable. But I mean, that's dependent upon your social media habits, but that's something that I really benefited from. And also remember that you chose to be there. There are gonna be days where you feel so worn down, and or like a resident may have said something mean to you, or an attending may have discouraged you. But just remember how much you killed to be there when you were a pre-med, and how much you desired it, how you would voluntarily spend hours in the OR, being excited at the idea of being there as a med student one day. So we can really take these things for granted when we are jaded, and when every day just seems like a repetitive pattern. But just continuously being reminded of that and giving gratitude really helped. The hardest part about rotation is balancing the art of studying for the shelf as well as doing well in the rotation itself. um, what I mean by this is, let's say you're on internal medicine rotation. Now, for that, you are responsible for a couple of patients. You know, you want to present your patients really well, and you want to read up on their lab values and imaging and all the updates. You want to study that patient's diagnosis, you want to come up with a good management. And these are all things that would make you look great if you worked on it after you come home. But if you do that, you might not have time to get through all of your questions for the night. So it's really picking and choosing what's important for that night. Let's say I have a presentation due right next day. I might not be able to prioritize URL questions that night. So that's the art that you really have to work through. You're going to be working 60 to 80 hours a week. And when you want to just sleep in on the weekends and hang out with friends, or after a long day, all you want to do is just sleep, you still have to study. And so having energy for that, it could be quite challenging. Know your position. You're a medical student and you're there to learn, right? And what really helps me is thinking about all the positives. I'm not a resident yet. I'm not an attending, so I don't have this immediate responsibility of a patient's life yet. But I have all the privileges of being part of a care team, and so I have access to all their charts, and I have the ability to talk to the patient. I could be a part of coming up with management. I mean, these are all things that normal people would not be allowed to do, right? The title of a medical student gives you that access and privilege to study human beings in such an intimate way. Think about it, like the physical exams, especially like in OB-GYN, you get like pelvic exams or DREs, in the emergency room. Those things had, if done outside of the medical setting, that's violation. But patients trust you to do that, and you yet still don't have the full responsibility as like an attending or resident. So you just really take advantage of that and learn as much as you can. You will still have some downtime here and there. You're not going to be working 24/7 when you're at the hospital. That's impossible, especially because you're a medical student. There are some things that you still can't really do. So for those times, be prepared to, again, use your time wisely. I wish I had made a system before going into clinicals of exactly what I'm going to work on if I have those scrap times. So what I would suggest doing is downloading the Anki app on your phone and going through those, or doing URL questions on your phone, or like a small iPad mini that you can put in your white coat. If you can get that, it'd be really helpful. And I think it's really good to set a goal of number of questions that you want to do that week or that day, and get those objective numbers out of the way. The heavy studying, the reading, and soaking up information through a video lecture, I don't think you can maximize it when you are studying with scraps of time. And so I would focus on doing flashcards or doing URL questions during this downtime. And the next thing, expect your emotions to be up and down. It's gonna be a roller coaster for sure. You're gonna see sides of yourself that you've never seen before, kind of like because you're in a relationship with medicine. Not every day is gonna be perfect. Not everything's gonna go according to your plan. You're not gonna be able to finish all the questions that you wanted every single day. It's just impossible, and you have to be okay with that. You have to accept it, or else you're gonna go insane. This is a time to be extra nice to yourself. Now, as overachieving people, that's really hard, but that verse, love your neighbors as you love yourself, that's something that I haven't taken really seriously, because if I don't know how to love myself and treat myself well, how am I supposed to know how to genuinely and truly do that for other people, right? You're gonna go through some hard things. I remember my first CPR. You can feel the ribs breaking. um, and it's heavy stuff. Like I talked about, quantity of life versus quality of life, what is best for the patient, some deep questions that, a sit-down desk job probably wouldn't ask. But those are such beautiful moments in medicine. And those are the moments that I'm most thankful for, because I cannot believe that my job is that meaningful. Camaraderie and support, do not underestimate this. It's so important and vital. You cannot go through medical school on your own. Try to make a good group of friends within school and outside of school. Share your experiences with people that are not in medicine. Oftentimes they will express awe and help you just see how astounding what you do truly is. And then for those moments that you feel so jaded, or you feel so discouraged, or the hard life talks that I just talked about that only possibly medical people can understand, you can talk about with your colleagues, and it's so important to do that. So do not underestimate that. Trust me, my quality of life dramatically changed, because during preclinicals I didn't really acknowledge the importance of that. So I highly recommend. Next tip is to ask for feedback early. Maybe at the end of the first week, or beginning of second week. Ask your attendings, hey, are there any areas that you see that I can improve on? You don't have to wait until your midpoint evaluation or end evaluation to see where you can improve on, right? Then you can't really track your progress. If you are able to identify your weaknesses and really try your best to work on them, and if that really does improve, then you're gonna feel so much fulfillment, and you're gonna know that you got out in a really important skill out of this rotation, aside from successfully completing it. So yeah, take in the criticism wisely. So what I mean by that is, don't let this completely destroy your self-confidence. If they give you criticism, or constructive criticism, it does not define you as a whole character, right? I think sometimes students can really get discouraged by mean evaluations, but don't beat yourself up for it, and be your best encourager. Like I said, be nice to yourself, and just take it for what it is. This person is not going to be in your life forever, and this person doesn't know you personally, right? It's just seeing you as a growing physician, and so don't take it personally is what I mean. All right, moving on to last tips. So go into every day having something to look forward to, and that is, within your freedom to choose what that could be. So that's really nice. And when you think of things that could make that day great, then your brain will be kind of primed to focus on that stuff throughout the day. So I don't know, it really helps me. Think of 3 things to be grateful for every night and every morning. It might take a while, it might take a little bit of time in the beginning, but it's like a muscle. You just flex it and it gets easier and easier. I have a 5-minute journal that I keep, and literally takes 5 minutes, and I just write down what I'm grateful for. Okay, and this is the single-handedly the most important tip that I want to share, and personally that really changed the trajectory of my medical journey and my medical school life, is this verse, Colossians chapter 3, verse 23 to 24. Whatever you do, work heartily, as for the Lord and not for the men, knowing that from the Lord you will receive the inheritance as your reward. You are serving the Lord Christ. Knowing who your master is. You don't, it says God didn't put you in medical school to impress and to be fearful of men. God put you there because he has a purpose for you, and he has a plan for how he wants to use you for greater good, and for his gospel, and to bring love care and salvation to people that he loved. And so if you put all your self-worth and identity in what these men are going to think of you, or the feedbacks that they give to you, your identity will be shaken quite easily. But if you know who your true master is, and you don't have to impress men, but you just need to impress God, that heart of integrity will be there. And as I always say, God's always looking for not the product, not just merely acts, but the heart of worship. He cares about the heart, and how amazing it is that we serve a God like that. So this verse always gives me freedom, and lessens my fear, and gives me such an easygoing spirit, because I know that my authority is not men who are imperfect, but in God, who's gracious and gentle and forgiving, and encouraging, and is for me and on my side. Okay, well, those are all the tips that I wanted to share with you guys. Let me know if they helped. I hope that they did. And let me know what other videos you would like to see. And you don't have to certainly stay for this part of the video, but if you are struggling right now, just with low self-confidence, if you're having a lot of doubt, if you're in a lot of fear of failure, you're doubting whether you belong where you are placed, I want to pray for you, if that's okay. So let's bow our heads. Dear Lord, thank you so much for this opportunity to pray for whoever's on the other end of the screen. God, I just lift up this person to you. I know that you know exactly what they're going through, all of their complex emotions and their exact circumstance. Lord, I may not know, but you know to its exact detail. Lord, I pray that you bring healing to this person in this moment. I pray that you root their confidence in you, and I pray that you remind them of your purpose, remind them that you chose them, and remind them of your love and your gospel. I pray that you restore their confidence, Lord. I pray that you just remind them of the past testimonies and how you were at work in their life. And I pray that you help them see that you don't change, and that your hands will be in their current situation as well as moving forward. God, thank you. And in Jesus' name I pray. Amen. Okay, guys, see you later.